so there's a common misperception between CBD and marijuana. All right, so there's a difference. And CBD is derived from a hemp plant, which is a cousin to the marijuana leaf, but not the same. And then it's a compound derived from that hemp plant in itself. Now, THC is a little bit different. It does still regulate the same system, but it kind of hijacks the system, right? That's why you start to feel intoxicated. That's why you start to hallucinate. And so CBD is different because we don't have what's considered or what's called psychoactive effects, where you don't feel like you can function as well as when you are obviously ingesting or taking in marijuana, which has that THC compound. So there's the big difference. So that's why we say CBD doesn't get you high, but you get all of the health benefits that marijuana naturally is connected to, but also with the risk of THC. So my line of CBD is called Ease Away. And I get tons of questions about why did I add CBD into the services? Generally, I use CBD to enhance our treatment. So when I say enhance, CBD has a known basically characteristic where it interacts with something called the endocannabinoid system. Now this is a very complicated name. You're probably going to forget it. It doesn't matter. What this system does though, it basically helps to regulate a couple of different things like your mood. It helps to regulate your digestive system. It helps to regulate your pain perception. And so when we are introducing CBD, this is going to interact with that system. It's going to actually help deliver those messages to that system a little bit faster. It doesn't necessarily send or create that signal itself. It helps this system to kind of, or give it a boost in those areas. So as a result, when we add CBD into your treatment and your services, we are addressing, nerve pain and inflammation that can come from there. We are addressing anxiety. A lot of people have issues with anxiety and staying calm, and so it helps to calm your mind, and that's also going to lead to more relaxation. We're helping with the digestive system. So when we are using CBD, it basically boosts this system. So we have two different applications for CBD. So naturally, when you come into the office, we use more of our solve and our cream. And so this has been, kind of popular amongst our patient base. Generally, after they experience it, they want to take some home and use it as well. And again, we encourage that, gives them something to kind of utilize in between our visits to kind of help manage their pain and their inflammation. So the cream is more of the external application, right? So we're going to be targeting specific areas that are giving us trouble. And so we want it to be more effective in those areas as well. Now, the difference between the cream and, let's say, an internal application of our CBD, generally we apply our CBD internally by either our gummies or our tincture, which is our oil, which you can take a couple of droplets under the tongue. Now, this is more of the full body application, right? We're not targeting specific muscles or joints that we're trying to get to calm down. This is going to be a full body regulation. And so we lean more towards the internal CBD when we're trying to regulate sleep, or we're trying to get our entire bodies to become less achy, when we're trying to get more rest. Again, we want to kind of encourage our patients to take more of the internal application. So that's the difference, again, when we are targeting specific areas of relief versus the entire body. So the entire body is more internal, external applications targeting specific areas.